My name is Jason Morris. I'm a OBGYN with Canyon View Women's Care. I lived here in Utah for a few years when I was going to college at Brigham Young University. I then did my medical school in Arizona at the University of Arizona in Phoenix before going to Texas for my residency in obstetrics and gynecology at the University of Texas in San Antonio. I now live in Spanish Fork with my wife and 5 kids. I have 3 girls and 2 boys, and they keep me plenty busy. In my free time, I enjoy exploring the outdoors. Here in Utah, we're blessed with a lot of great outdoor opportunities, and so just going off on a bike ride or exploring the lakes or rivers in a kayak, taking my kids hiking, going to see waterfalls. I enjoy any hike that involves water. That way there's a reward at the end, some place to cool off. As an obstetrician, one of the things that I really enjoy about my job is really developing a relationship over a long term with patients, where I see them early in their pregnancy, get to address a lot of their questions, and as the baby grows, a lot of times the questions change. And being there for that patient all the way through the delivery, where we have this unique experience where we as doctors get to participate in bringing new life into the world and having mom and baby meeting for the first time there. Usually there's a lot of tears, but it's unique in medicine that it's often tears of joy. You don't get that in a lot of other medical specialties. So obstetrics in particular is a very happy medical specialty where we get to help women become moms for the first time. During my wife's first pregnancy, where we were having our first child, we got to kind of experience some of the good and the bad that can happen based on the provider-patient relationship. We had been seeing a provider through most of the prenatal care, but then when it came time to delivery, it was a doctor who we really hadn't worked with that much. And the communication and the relationship of trust just really wasn't there. And so we had this kind of tug of war back and forth about what the doctor thought was best and what we had kind of questions or concerns about, and it felt like we weren't really talking clearly to each other. And so as a provider now, I try and really focus on just being an open book, let you know what I'm thinking, what I'm worried about, and why, and then hearing your response and what you want to do. And ultimately, you know, the decision lies with you, what you want to do, because you're the boss here. I'm just trying to help you get through it. I think coming to the doctor for an annual exam is a good start for just being aware of your health and things that are on the doctor's radar, things that you should be aware of, things to look out for, give you some preventative information, things to let you aware of what could indicate a problem. And so having those annual exams, even if there's no problems, coming in, having the opportunity to talk with the doctor, have the doctor ask you some specific questions, things that maybe you didn't even realize could indicate a bigger problem, and addressing those at that time. One of the things I really enjoy as an OBGYN is working with Spanish-speaking patients. En mi experiencia he visto que poder hablar con un paciente en su propio idioma es algo muy agradable para la paciente, tanto como para mí. Y me gusta poder ayudar con las pacientes con su necesidad, ni importa lo que sea.